Welcome, everyone. This is Helena Esmond. I'm Chief Clinical Officer and co-founder of Vestibular First, and we're going to be interviewing a very special guest today. Her name is Amy McMillin, and she is a physical therapist and an excellent vestibular specialist, and she's going to give us some insights into what it's like to have your own mobile physical therapy practice. So thank you for joining us today, Amy.
Thank you. Good morning. I'm so excited to be talking with you and just an opportunity to kind of spread the word and share my experience as a mobile vestibular therapist. So thank you.
Oh, it's our pleasure. So we have quite a few questions. So we'll try to get through them efficiently because there's a lot to know about this topic. So the first thing we want to know is just kind of what was your career path between graduating from physical therapy school and starting your own mobile practice?
So I graduated back in 2007, and I have been basically with an outpatient orthopedic and neuro group for about 14 years now. And they needed a vestibular program started back in 2014 or 13. And they had approached me. And I always had an interest in vestibular therapy because in grad school, we had a 3-day, speaker come in, and I didn't understand it at all. I was like, I have no clue what this guy is talking about. And yeah, now he's kind of a mentor and I still talk to him. Hi, Andy, if you're listening. And so I didn't understand it at all. And that perturbed me in the worst way. So when the opportunity presented itself to do a vestibular program, I raised my hand and said, me, like I want to understand this and know about it. So I went to apply to the Herdman course in Emory University, and it was such a demand. It took 2 years to kind of get in. So I bought the books. I went to the UPMC vestibular course with Whitney and Dr. Furman, and started self-teaching. And so I started in like 2014 with my vestibular practice. And finally, I have a kitty, a helper here today.
Awesome.
And so since 2016, it has been 100% dizziness, migraine, concussion kind of population. And so this past year, it was less than a year ago that I started my mobile practice. So we'll go into a little bit more detail about that. So, but about a year in the mobile practice, or just shy.
Nice. That's
Mhm.
awesome. So you definitely got some good training under your belt first in your
Mhm.
specialty, it sounds like. And then you kind of decided to go out on your own. So let's
Mhm.
talk about that. What motivated and inspired you to start that mobile practice of yours?
So I've always had like a super strong work ethic. I came from like a family of tradesmen who were business owners. So, I got to see the benefit of the autonomy and kind of that satisfaction of cultivating your own work. But also there's that insecurity of like not knowing if things will come in. So basically during the pandemic, I saw that opportunity to kind of fill this gap that I've noticed in the clinical practice for the past 5 years that I've been doing, where patients had trouble being compliant with therapy. Whether it was, I had one opening on a Tuesday at 1 o'clock and they had to work. So there's time off of work. They're too symptomatic to drive. They have kids and it's money for a sitter, or they can't manage that family life. Getting to therapy, you're asking somebody to take time off work, find a sitter, and drive while they're symptomatic for a 45-minute session, 6 to 8 weeks. That's a commitment. So the people who can commit do well, but the people that can't, there's that gap that I was hoping to fill, because I love helping people. It does work. Vestibular rehab works. You just have to do it. So that's what inspired me to kind of fill that gap, and bring specialty care to patients in the home and the convenience of that.
That's awesome. I really super love that.
Mhm.
So what steps and skills did you have to put in place to do all this, to start and grow your mobile practice? And in my head, I'm just up the top of my head, I was thinking, gosh, financial considerations, liability insurance,
Yeah.
creating your own business, incorporating yourself or what have you, direct access situation, billing and
Yeah.
coding knowledge,
Yeah.
belonging to the private practice division of the APTA. I mean, I'm sure the list goes on. So what kind of did you feel
Yeah.
like were kind of key elements that you had to put in place?
Yeah. So with thinking about that, I kind of can't believe what happened to be able to do this. It's kind of amazing. And you look back at it, you're like, I can't believe I did all that. So first step, getting a lawyer, and a
Okay.
business lawyer, and making sure that you're doing everything legally. So I had her set up the LLC. She knew exactly what she was doing as far as getting your business license for the state. She did my consent forms and the HIPAA forms and all of that to help do policies and procedures. So I think that being, legally protected is number one. So getting your lawyer. Know that you have to have liability insurance. Um, and then as far as the investment, very low overhead to begin, because I didn't know if there was a market for this. So with the lawyer, I did all my own forms. I researched on, YouTube. You can find a lot now. I did how to do your own website. So I did my own website, and then I
Beautiful, by
had,
the way.
oh, thank you.
Seriously.
Thank you. And then, I had a couple friends who made it function. So if I want to accept payments, for example, if I want to sell classes. So I do have a person, and I think that's super important of making it function. You can make something look pretty, but he actually makes it function. So thank you. And so with that, I think it was about $2,000 with equipment, lawyer, forms, insurance. So $2,000 investment isn't that bad. Now, growing for sure. Once I get, some more financial inflow, then I will definitely be investing in other equipment. So
Right. And just for reference, you're in Ohio, is that correct?
yes, yeah, I'm in
So I'm
Ohio.
sure the prices
You asked
vary
about
a little
direct
bit depending
access.
on where you are as well, but that's just a
Yeah,
good
yeah.
benchmark for people to be aware.
Yeah, and direct access wise, I think that's important because Medicare, of course, needs a script or referral, but commercial insurance, we have direct access. So all you have to do is know your state practice law and study that, and basically within 5 days, you have to, send the evaluation to a physician and refer back within 30 days. So know your practice law. Mhm.
Always a good piece of advice there.
Yeah, yeah.
Um, awesome. Okay, well, those are some great insights. So let's talk a little bit about what kinds of patients you're seeing in your practice and why, and kind of how that evolves.
Mhm. So I guess just because I studied the most in vestibular patients, I treat concussion, persistent dizziness, acute dizziness, migraine, headache. Um, that is just the language I speak. I don't know how else to say it, but I totally understand what those patients are talking about. I get it. I understand kind of the complexities and how symptoms are influential and things are congruent. So it speaks to me, and I get their language. And a lot of physicians and medical providers, they don't understand those patients. So it's something that you just get, I suppose.
You
So
get it, right?
you get it, you get it. Yeah.
Awesome. So do you find that other types of patients are referred to or fall into your lap beyond vestibular patients?
So I think like the word of mouth, basically the other thing that people are attracted to is that convenience, the comfort. You can have your kids, in the house while we're treating in the other room. People are really drawn to that. So when I get an orthopedic injury, people just want to be heard. And I think that's the main thing as a professional, that you understand that maybe I'm suffering from back pain, and maybe somebody would say it's just back pain, but no, I can't run now, and now I can't get out of bed easily, and now I can't, this is affecting my life. So It doesn't really matter the injury. It matters how you present yourself to a client. If you hear them and you hear their, their dilemmas, their disorder, whatever, you're going to make progress just by having that anxiety component of going, somebody's listening to me. They're empathetic, they're compassionate. That goes a long, long way. So
Really?
Short answer, long answer, yes. Orthopedic, injuries, fall into my lap as well.
I would imagine that usually seems to come up. I feel like once you also, as you're mentioning, build trust, people might see you for a vestibular condition, but then later they want to see you for their orthopedic condition, or they want someone that they know or care about to see you for, their orthopedic condition or neurologic condition.
Because they know you're going to give them your best because you did before.
Right. And like any good practitioner, what you don't do. So if they need pelvic floor, you're going to say, hey, I think you should go see so-and-so. And I'm sure you have a list of folks that you would recommend for different situations.
Yeah.
Right?
Yeah.
So I think that's part of it too, is that you've already worked with clinicians. You've built what I would consider to be a professional network, right? If I can be so bold as to presume that. You know what I mean?
1,000%. That's probably a question you're going to ask, but to have a network, it is not a competition. This is one point in a patient's journey, and I may be one point, but another point may be a pelvic floor, or somebody might need a naturopath or a chiropractor or a personal
ENT,
trainer
or a neurologist that treats vestibular migraine.
Yes.
Right.
Yeah. The list goes on, but you are one point in that patient's journey. And if you can act as, a case manager of sorts, to have that patient have a complete and comprehensive treatment plan, that's what you need. One, to build your network, and two, just to be a good therapist.
For sure. No, I think I am always wary of any clinician who says they can, treat anything without ever in any case needing, to refer or to, work with other practitioners. That's a red flag to me, actually. I think we should all be a team, especially with concussion. I don't want to be alone treating this patient.
Yeah.
A lot going on sometimes. So that leads us into kind of equipment questions. So what equipment do you have, and what would you like to have for your mobile practice? And, you're not in a big gym, you're not in this big facility. How can we provide that level of care?
So definitely a treatment table. I got a really cool telescoping stool. That's awesome. I have, my little pencil box full of my gaze stability sticks, my Brock string, tape measure, VP cuff, pulse ox. It's amazing what I can fit into this bag.
Like Mary Poppins.
It just keeps coming.
I love it.
Yeah. A foam pad, an eye chart for dynamic visual acuity. So that would probably be the basics, your massage cream, your kinesio tape, your scissors, all of that stuff. Goggles for sure are on my list, because I have treated in the hospital where you can afford those big budget items, and it is a game changer. When you have to pick up on like a cupulolithiasis in that horizontal canal, or something, something minuscule that's just left over. So the goggles definitely are important. If you are starting out and you have a BPPV case, back in the day when I first started out, those brisk nystagmus, the typical posterior canal, those are easy to see. So, that's nice, but it is a game changer with those goggles. So that's on my list, for my wish list. As far as like weights and strengthening and thing like that, I have ankle weights and a Bosu ball that I bring with me. Everything is packed up in the car, and I grab it if needed. TheraBand, of course. But I love to do, and I think it's important because that patient doesn't have my big gym equipment. They go and see you once, twice a week. Is that really, going to work? Is it efficient? No, I treat a lot on functional weight training. Nice. So if you work out yourself, that squats, lunges, some planks and core, there's so many ways to have functional strength training. if needed and balance.
Think of all the ocular motor exercises people can do when they put away dishes. I'm telling you.
Yes, yeah, everything is functional.
Word, man.
People are like, when do I do this? I'm like, every time you're reading your phone while you're walking, you are doing gaze stability exercises. If you're walking on a treadmill and you're reading subtitles on the TV, you are doing gaze stability exercises. You're doing this all day long. So yes, we have to be creative. But yeah, you don't need a ton of equipment to get started.
That's awesome. And I think that's good advice. A couple key elements and you're good to go. And I think I'll make it a goal of my own goal to, I already have kind of what equipment do you need to have a vestibular clinic article on our website, but I think building one kind of specific to mobile practice based off your recs. And maybe I can even get a couple links from you, like that stool might get a lot of sales if we can put that up, because that sounds like the kind of thing that folks would definitely be interested in. So I'll lean on you for that.
Okay, awesome.
I love it. All right, cool. So how do you handle payment? Everyone's worried about finances, right? We got to make this happen. Insurance, private pay, cash base. What are we doing here?
So I'm a hybrid. I did enroll with Medicare. And there's a lot of Facebook groups for people that are thinking about starting that are for cash-based therapists or mobile therapists that offer a lot of good information. So yeah, I got a lot of good information on how to enroll in the Medicare process and everything. And there's you have to understand your payer mix in your area. And Medicare is maybe 60 to 50% right now of my payer mix. And that's great. Absolutely wonderful. So enrolled in Medicare as a participating provider. I use Office Ally as a clearinghouse to make sure I do my batches. I think you get like 10 free batches each month. So I make sure I do all my claims, on like Friday afternoons. So I'm doing like 4 or 5 batches. So that's how I get around Medicare. And then everything else with commercial or Advantage plans, that's a different discussion, but commercial, is just private pay. And I have like a super bill that I will give, an itemized super bill that I'll give a patient, and they can submit to their insurance for reimbursement, except HSA, FSA. So that's my little hybrid mix. And it just takes a lot of studying to figure out how that's happening. And your how to fill out a CMS 1500. Oh my gosh, like that's so brand new. That took me a few tries to get through the first denial batch. So, but yeah, it's a learning process, and now it's working out fine.
Cool. And you take care of that yourself. I know some folks do pay someone or find a company, but I guess that's just kind of another expense you didn't want to have at this point.
That's another expense. And I think the more that I know about the billing process and understanding, it's helped me tremendously on how to understand what's reimbursed, what's what are the costs, the manual therapy. I'm going to make sure that that's not reimbursed very well. So I'm going to make sure I'm spending a little bit more of a mix on my sessions.
Right.
So I think it was really important and eye-opening to understand on how to do your own billing. And if I get bigger, maybe, but right now, as starting, I'm keeping the cost pretty low.
I think that's good insight. And I think what that points out is like, this kind of phrase I've heard, which is you shouldn't, manage someone on something that you couldn't do yourself if you had to step in. And I think that's, particularly key as a business owner, which you are, to say, yes, like even if I end up handing off billing, in a general sense, at least, I understand it and I know what's going on with it. And I think that's good for multiple reasons. Like if something happens to the person or company, you could, fill in as a backup, but also just to really have that knowledge. It's a really great point.
And if you hire somebody or anything, like you want to know exactly how to explain, or if you take somebody on, you want to know how to explain that behind the scenes.
Perfect. No, good points. So that kind of takes us into how do you get patients? How do you market? I mean, you mentioned word of mouth, but are you doing any kind of formal advertising or not at this point? How do you attract and retain folk?
So it started off word of mouth and my own like social media. And I have basically done the kind of the grassroots, where you call on some physicians. I've had success with some ear, nose, and throat doctors. It is hard to get into the bigger corporate hospital systems, because they have their own internal referral, and I'm not stepping on anybody's toes. I'm offering a mobile practice for those clients who can't get to your clinic. So I am just, another cog in your wheel. And I understand that you have your own internal. So you just have to market that, hey, I'm not treading on your territory, but I am there for the patient who you do want to be better, but they just can't get to your clinic.
And I bet you get referrals from other PTs. Am I wrong?
Some other PTs, I'm sure. I haven't done that yet. Right now, I'm so busy from just word of mouth. And so I haven't gotten there yet. But I know that is important. And I will get there. And personal trainers, gym owners, ear, nose, and throat doctors, concierge doctors. That is an untapped little market because they have the same model.
Right. That's your same market essentially, because the people who want a doctor concierge, I'm sure would be interested in a concierge. So that's a really great point. But I'm also just thinking of, I don't know, as a PT who works in a clinic, I'm happy that luckily there's locally, for example, a neuro group that does outpatient in the home, because sometimes I have a patient who just logistically or whatever, it's not working for them to come into clinic. And I don't like to see them just decline because they're not getting care. So it's nice. I think, I don't know if I'm giving you ideas, but, to have, PTs in the area know, like, hey, like, this is what I'm doing and I'm happy to help, these patients that you might worry about, you know what I'm saying? Like, because we all, at the end of the day, hopefully as healthcare providers, just want to help patients.
We want to, sure. That's definitely on my list with, athletic trainers and that just building that community. So there's a lot of untapped market, but we are all there to complement one another. So, and I'm right for some people and not right for others. And that is okay. And I think as providers, we have to know that. You have a niche. If somebody fits that niche, awesome. That's what you're there for.
For sure. And in that vein, are you doing any telehealth?
Not yet. I'm set up for it, but I don't know what your opinion is. It is quite difficult to treat BPPV or some of these dizzy. You have to put your hands on people sometimes. So I haven't found a good client yet for me in telehealth. So no, not yet.
And I think being concierge takes away a lot of the barriers that would result in telehealth perhaps for somebody who's in a clinic. But what I'll say is I do have one telehealth patient. She has vestibular migraine. And so much of our work has definitely been education for her, that it actually has worked really well. And she's safe enough balance-wise that I don't feel like if I give her an activity, she can't be safe without me right there to guard. You know what I'm saying? So I think there are folks that I think it can work well for. And she was very concerned about COVID to the point of not wanting to interact with anyone in person directly, which is fine. So I think luckily it just worked for her situation. I agree that there are cases where it's difficult, kind of, it's better than nothing type of thing to talk someone through maybe Dix-Sulfide and trying to guess they might have a certain kind of EV and trying to take them to a treatment. It's certainly better than them just suffering without care. So, you know what I mean? Like, I think it can be a gap filler, but obviously if someone could have someone come into the home, that is definitely a good alternative as well.
Definitely not opposed to it. Your 3PD, anything that might be related to maybe functional neurologic disorder, where you're doing a lot of grounding and somatosensory work. There's a place for it for sure. But I just haven't needed that yet, but I'm glad that it's there and I am set up for it if needed.
That's good to know. Awesome. It's just been a kind of a hot topic of late. So, figured we should at least touch on it. And then what do you think overall are the biggest challenges and benefits of having your own mobile practice? You kind of highlight just a couple, I think.
Challenges right now are that life work balance of picking which 14 hours a day you would like to work, after the kids go to bed, up till midnight working on forms or finishing paperwork or something like that. I think I sent a fax over. Yes, the old standard fax. The standard, so many doctors, they still use it. So yeah, we had a landline, so I just used fax. I'm already paying for it. So I sent a fax, I think at midnight last night. So figuring out which 14 hours a day that you would like to work. And the challenge has been just that safety net of working corporate. And I love my job. I love my patients. That trying to transition, or not even knowing if I want to transition completely. This was just, can I do this? And it's turning out that there is a market for it. So the big challenge has been still working, my main job or, corporate job, and transitioning into a business owner. And that has been a challenge, but an exciting one. So the benefits of having my own practice, I get to make my own schedule on my own timeline. I don't have to rush with patients. I love the fact that I can sit there for an hour and 15, get to know somebody, and not rush out of a treatment because the next one is there. That's just that burnout. I don't feel it with the mobile practice, and that's worth a lot to me.
It's a really good point. So new grads, I think, are really aware of the potential for burnout coming out the gate, rather than having to experience it firsthand. They have heard about it or observed it. So I think some of them are considering mobile practice as an option. And I think it's definitely, like I said in the beginning, a growing area. So what advice would you give to a new grad? Do you think that they should try that, doing a mobile practice right out the gate of graduation? Is there a certain point in someone's career that's ideal to start a mobile practice? What are your thoughts on that?
So I wouldn't change anything from what I have done. I would not personally have felt comfortable. We don't get a business degree in school. We learn so much that you go out knowing how to do a little bit of everything. And I don't know, I have helped establish myself for the past 14 years. So when you say, who do you call on, who knows you, your reputation is built up in the community. If you go out right away and say you don't do a good job, let's just say you don't, and then that is your presentation into your community, into your doctors, into your word of mouth referrals, your Google reviews aren't too good, that's your first shot. So now granted, get in there for an hour, get for a year, get your feet wet, learn from there's always so much learning. You can never learn enough. Forever you will be learning and reading books. If you want to do something on the weekends, or part-time, why not try it? But maybe just establish yourself first in the community, build up that reputation, find your network. If you build your network, then people will be more likely to refer to you, look you up, Google you, whatever. So I personally would wait and make sure that I am using my reputation to build up my network first. So you get one chance at that.
I would agree. And I think what I would add, maybe if I may, is that, when you're starting out, there's so much just to figure out with kind of like, do you want to do a specialty or not? Do you want to get your NCS, your OCS, or some sort of kind of formal specialty certification or anything like that? So, being in a larger organization, what I'll say is that sometimes they support, like, oh, you want to get McKinsey certified? Sure, we'll pay for that. And so kind of, getting those benefits, we'll just say, and kind of the mentorship that might be available to you in these areas, depending on where you're working, may be more supportive or less supportive. So you do have to kind of be judicious, I think, and try to find, okay, where's the most to get for my next step, right? Kind of having this whole 5-year plan, 10-year plan, and it may change and pivot. Believe me, I did not picture myself owning a
Mhm.
medical device company.
Yeah, yeah,
That came later
yeah.
because it fell into the kind of necessity as the mother of invention. But I think, just kind of respecting that kind of opportunities, and like you're
Mhm.
saying, in multiple ways, how that can build the right next steps. So if you're really thinking strongly of doing a mobile practice, you can have that say, okay, in 2 years or in 3 years or whatever you think is
Mhm.
right for you, and what do I want to have done or have accomplished or have in place ahead of that,
Yeah.
and what job will help me get those things to be ready. Is
Yeah,
that
when you're interviewing, absolutely. When you're interviewing to a large corporation or whatnot, what career ladder, what support can they offer? That's a benefit that you have to take into your interview. So maybe, yeah, it can set you up for your mobile practice a few years from then. So great
perfect?
point.
All right, we're almost done, but we're going to
Mhm.
ask two more things. One is, what has surprised you the most in doing a mobile practice so far?
That actually people wanted it, and and I was right. There was that gap that needed to be filled, and that people they want to be heard. They want that individualized care, that comfort and convenience, and that there is a thirst for changing the medical, business model.
Hmm.
Um, it does not particularly have to be dictated by insurance companies per se. That you would gladly pay for Amazon Prime if you know that you get some more benefits to that. Why do you go to a place? Why do you pay for extra? Because of the care, because of the convenience, because of the benefits. So I was surprised, yeah, if you provide something that people want, yeah, there's a market for it. That surprised me the most.
Yeah, I've been surprised too, even in clinic, how there are people who will track me down from where I worked before, and um,
Mhm.
they're like, don't care if they're out of network or have to pay
Yeah.
cash, like, because to them, again, and that's where I think your skill level would come into play, is having more training and things like that ahead of time, because then they know, look, if I have BBBB and I see Helena, she's going to clear it.
Mhm.
And, if I have, this really kind of weird thing going on, she's going to figure out what's wrong, or she's going to know who I need to see. Like, people want results, like they want success. They want, and
Yeah.
if they believe, and not, hopefully not erroneously, that
Yeah.
can provide that, they're willing to spend cash on their cars, on whatever. I mean, I'm
Mhm.
thinking all these folks are rich, but my point is that you budget, right? And some
Yeah.
people literally have a health budget, like that's enough,
Mhm.
whether it's their massage every week or whatever it is that they pay cash. And so some of them are very open to, even if they have insurance, saying, you know what, for this, I am happy to just pay. So I
Mhm.
think kind of keeping that in mind. There are going to be folks who can't see you if you can't take their insurance in their cafeteria
Yeah.
or whatever. I get that. So that does
Mhm.
happen too. But yeah, I think I'm just jiving with your, how it really is there if you
Mhm.
can build the right kind of skills and
Yeah.
folks who are needing those skills. So we'll
Mhm.
cap it off, wrap it up here. What advice and pearls of wisdom that we haven't already provided, or that you have not already provided so wonderfully in this conversation, would you give if you could go back in time to when you started your mobile practice?
Hmm. Um, Anything back in time. Um, I really love how I did it. Like, if you want to, I did invest in like a marketing coach. That was after I made, my first. I'm like, okay, this can work. So right now I'm invested in a marketing coach to help me um with that portion. What are the steps to make this not a fluke, but a system, a system that's repetitive. I'm horrible with automation and, reports and landing pages and all of that stuff. So, if you want to make a bigger investment off the bat and you really believe in it, I highly recommend, having a marketing budget. And if you know your product and you know that you're going to do this, invest in a marketing budget, and that will help you feel more secure and help those referrals come in, so you don't feel the anxiety of, is today a referral going to come in, is the phone going to ring? So I think that would be one thing that I would consider adding into your overhead budget at the beginning.
Great
So,
point.
mhm.
Cool.
And yeah, just slow and steady is okay. You know, we had talked about if you have like a backup plan, or if you have a corporation maybe that you work for, you had mentioned that you needed part-time for work, life work balance. So get yourself a part-time or a PRN job, so you feel less anxious about your business, and then grow it slow and steady from there, and build up your network. So you're one point in a person's journey. Pull from where they came from and where they're going to go after, and then you'll land in the middle. So,
That's right. Yeah, I would think building relationships too with home care PTs and home
mhm,
care organizations, because that's kind of a gap sometimes where, they technically are, cleared from home care, but there may be some other barriers of various kinds that would,
mhm,
they don't end up in the outpatient clinic again.
mhm,
So yeah, there's definitely a lot of room, I think, for mobile practice. So it's
mhm.
awesome, and exciting. And thank you for doing it. And
Yeah, hopefully I shared some, some kind of good information. Thank you so much for reaching out and doing this interview. I really appreciate it. And thank you for the work that you did with the goggles. And I'm hoping that other practitioners will learn about your company and look into those.
thank you. Yeah. Well, like you, I always feel like I'm learning, and I love that. So that's exciting. And business is definitely a whole area to grow in. So anyone who's interested in mobile PT, will certainly be available for questions, and we'll try to share Amy's website so that if you wanted to contact her with questions, you would be agreeable to that.
Yep,
Um,
absolutely. Yep, absolutely. Absolutely. You can reach out and yep, we can talk for sure. Thank you.
Fantastic. All right. Well, thank you for that. And hope everybody has a great day.
All right, thanks. Bye.